Spondylosis is a term referring to degenerative osteoarthritis of the joints between the center of the spinal vertebrae and or neural foramina. If this condition occurs in the zygapophysial joints, it can be considered Facet Syndrome. If severe, it may cause pressure on nerve roots with subsequent sensory and or motor disturbances, such as pain, paresthesia, or muscle weakness in the limbs. When the space between two adjacent vertebrae narrows, compression of a nerve root emerging from the spinal cord may result in radiculopathy. Less commonly, direct pressure on the spinal cord may result in myelopathy, characterized by global weakness, gait dysfunction, loss of balance, and loss of bowel and or bladder control. The patient may experience a phenomenon of shocks in hands and legs because of nerve compression and lack of blood flow. If vertebrae of the neck are involved, it is labeled cervical spondylosis. Lower back spondylosis is labeled lumbar spondylosis. Causes: spondylosis can affect a person at any age. However, older people are more susceptible. Diagnosis: Sperling's test is performed by laterally flexing the patient's head and placing downward pressure on it. A positive sign is neck or shoulder pain on the ipsilateral side, that is, the side to which the head is laterally flexed. This is somewhat predictive of cervical spondylosis. Hermit sign: feeling of electrical shock with neck flexion. Reduced range of motion of the neck, the most frequent objective finding on physical examination, MRI testing. This test is non-invasive and provides the only definitive positive diagnosis. Treatment: treatment is usually conservative in nature. Patient education on lifestyle modifications and non-steroidal anti-inflammatory drugs and physical therapy have been shown to manage such conditions. Other alternative therapies such as massage, trigger point therapy, yoga and acupuncture may be of limited benefit. Surgery is occasionally performed. Many of the treatments for cervical spondylosis have not been subjected to rigorous, controlled trials. Surgery is advocated for cervical radiculopathy in patients who have intractable pain, progressive symptoms, or weakness that fails to improve with conservative therapy. Surgical indications for cervical spondylosis with myelopathy remain somewhat controversial, but most clinicians recommend operative therapy over conservative therapy for moderate to severe myelopathy. Physical therapy may be effective for restoring range of motion, flexibility, and core strengthening. Decompressive therapies may also help alleviate pain. However, physical therapy and chiropractic cannot cure the degeneration, and some people view that strong compliance with postural modification is necessary to realize maximum benefit from decompression, adjustments, and flexibility rehabilitation. It is often argued, however, that the cause of spondylosis is simply old age, and that posture modification treatment is often practiced by those who have a financial interest in proving that it is caused by work conditions and poor physical habits. Understanding anatomy is the key to conservative management of spondylosis. Surgery: many surgical procedures have been developed to alleviate the signs and symptoms associated with spondylosis. The vertebral column can be approached by the surgeon from the front, side, or rear. Osteophytes and sometimes portions of an intervertebral disc are commonly removed in an effort to relieve pressure on adjacent nerve roots and/or the spinal cord. Non-surgical treatment modalities are also available. One can get in touch with pain management consultant to know more about these. Though these therapies, namely cervical epidural steroid injection, cervical facet joint injection, transforaminal injections, can be given at a day care basis. These procedures may alleviate the symptoms of the patient and may give a long-lasting benefit from the ongoing symptoms. Complications: a major problem related to this disease is vertebrobasilar insufficiency. This is a result of the vertebral artery becoming occluded as it passes up in the transverse foramen. The spinal joints become stiff in cervical spondylosis. Thus the chondrocytes which maintain the disc become deprived of nutrition and die. The weakened disc bulges and grows out as a result of incoming osteophytes. Laminectomy. References: Thomas, Clayton L. Tupper's Cyclopedic Medical Dictionary. F. A. Davis Company, Philadelphia, Pennsylvania. ISBN 0-8036-8309-X. Barron, M.E. Cervical spondylosis, diagnosis and management http, www.medicincom topic 564 htm. External links, cervical spondylosis at the Mayo Clinic.